Good afternoon. It is 2 o'clock Central, 2:03 Central Time. This is PAD Advocate, aka Felicio Factoriti, Dr. Factoriti, Dr. F, as some people, or most of my patients will call me. I am a heart and vascular specialist here in Cleveland. Once we have more people join, we'll get started with the questions, but I just want to thank everyone who's joined thus far. I see it. I see y'all. I see everybody. And joining me is my esteemed nurse practitioner, the one and only Clifton Reed. The brother is a bad brother when it comes to heart and vascular knowledge as well. We have worked together for a year, and I've told him to try and impart some knowledge on what's going on here, not only locally, but nationally too, when it comes to awareness campaigns. So this is his first IG moment with us. What's up, Clifton?
How's it going, Dr. F?
I'm doing good, man. Doing good.
Good. Just excited to be sharing this opportunity with you.
Likewise, brother. Likewise. I'm trying to wave at everyone as they join in. All right. So I guess how we'll do this, Cliff, is that we'll just go back and forth. There are questions that will pop up that we'll answer, but for now, I think let's just start with the first question that I received today, which was, how we have found high sugar or fat intake to be more detrimental to cardiovascular health, and is it different for every individual? So what are your thoughts on that?
Well, when we talk about plaque buildup, it increases the risk for diabetes and hypertension, also increases your risk for high cholesterol, all of which are major risk factors for developing cardiovascular disease. But I do think that there is a piece to that where it is different for each individual, just depending on family health history, age, and other lifestyle changes as well, such as whether or not the patient is actually active and exercising.
Right, right. The one thing that I found with patients who when you go to the community and churches and we talk to people who ask about their diet, people really don't understand that, what you eat in terms of your sugar intake, a part of it, there's fructose, and also, there's glucose, and how it's metabolized in your body differs. Most of your organs need sugar, right? Sugar is actually part of the building blocks of your body. It's just that when you take an excessive part of either sugar as a whole or more fructose, and it goes to the liver, and the liver metabolizes it, and it's overwhelmed, and it becomes fatty, or it starts having it build up in your cells that it releases it to, that gets converted to fat. And so it also blocks, one of the hormones that regulates, kind of like a thermostat, for how your satiety levels, so how hungry you are and what have you. So that creates this vicious cycle. The more sugar you eat, it's like the more addicted you are to it, and the more likely you are to develop either problems with high triglyceride levels or high, cholesterol levels, and then you start building plaque buildup, and it becomes, this clogged pipe. So sugar is the new tobacco. It's addictive. It's dangerous. It can cause bad outcomes, especially what we see now with diabetes being one of the #1 killers and causes of heart failure, heart attacks, strokes, and amputation rates in the country. So y'all need to watch that sugar, especially the sweet tea addicts out there. I know we're in the South, but we got to keep it real. You got to watch that sweet tea, man.
Yeah, and you stepping on some toes now.
It makes you wanna smack somebody, but it will get you. So that's my feedback on sugar. There are components to that that we have to watch. So everything in moderation, and don't overdo it. All right. Another question is, what type of exercises are good for the heart? I think that moderate to intense exercises are good for the heart. 150 minutes a week is what we recommend. And it's not walking through a Walmart or going to Kroger, or just hanging out with the girls and just walking half a block. That's not it. It's activity to get your body and your metabolism going to a point where you burn calories that are sufficient. So if it's brisk walking, if it's, running, if you can run. Some people have back issues. If you can swim, you swim. Aerobics are good. Those who are in competitive sports, that's great as well. Gardening is good. Anything tennis. People like playing tennis. People like ride bikes. But try and get active to a point where you can exercise for at least 150 minutes a week. That's the recommendation, because intensive aerobic activity has been shown to decrease heart attack rates by 90 to 98%. So the more we do, the better.
Yeah, absolutely. You brought up an interesting point about just walking through Walmart, because you hear people say all the time, well, I wear my Fitbit and I try to get in my steps, and it's saying I get in 5,000, 6,000 steps, but the question is, how much did you raise that
I
heart rate?
know,
So,
I know.
yeah. And
Yeah,
then, like the whole idea about tennis, I always tell people that's a great way to get exercise in if you're playing singles, because, you're kind of on an island by yourself. So it definitely forces you to run. So
right,
that's always a plus. Yeah.
right. But for those who have like conditions in the heart, like you want to check in with your doc before you get the clearance to do any crazy activity. And again, Clifton, there another question came in: effects of energy drinks on the heart. For our patients, what do you think about that?
And need to stay away from energy drinks for sure. All that caffeine and sugars, it causes elevated blood pressures. It causes elevated heart rates. It can cause heart arrhythmias.
Hmm.
And, as a former ER guy, I can't tell you the number of times I've seen young people come in that were doing energy drinks just trying to stay up. And would come in and they're in like irregular heart rhythms, like atrial fib, heart rates 150s, 160s, and never really had any underlying history. So, energy drinks are definitely bad and should be avoided at all costs.
Yeah. You see people who either work the late night shifts, some people who are truck drivers, some who are in the medical field, some nurses, doctors. They feel they need to drink an energy drink to stay awake. Well, what happens is that it messes up that electrical, connection of your heart, as Clifton says, and you get palpitations and your heart starts racing, and you feel like you're about to have your heart come out of your chest wall. And then that becomes addictive. So it becomes that vicious cycle, right? And then you get fatigued and tired. And then, it can also alter your sugar levels too. So just make sure that y'all avoid that, please. It's not good. There's a question here about heart failure. What is congestive heart failure? Basically, congestive heart failure is a supply and demand mismatch. So your body has organs and tissues, and your body makes, pumps out a certain amount of blood out of the heart. Whenever there's a problem with either insufficient or inadequate pumping of that blood out of your heart to meet the needs of your organs, so if it's a pump issue, it's called systolic heart failure, and then your heart has to relax and fill blood to not only allow the circulation of the heart itself to be adequate to go through another cycle of pumping, but it's to make sure that you have good oxygen flow to the heart vessels that feed the heart muscles. And if you have a problem with that relaxation component, it's called diastolic heart failure. Both are very prominent, especially in patients who have certain risk factors. If you are diabetic, you have high chances of getting heart failure. If you have high blood pressure, you have high chance of getting heart failure. If you had a heart event, heart attacks, coronary disease are the number one causes of congestive heart failure. But other causes are interesting, sleep apnea. If for everyone who lives in the South, I didn't know this till I moved down here. If you call the hogs, all right, So, AKA, if you snore, yeah, you are gonna definitely have sleep, congestive heart failure or irregular heart rhythm. If you've had a diagnosis of valvular problems, so the chambers of the heart have valves that separate them, that can cause congestive heart failure. And if you have had any type of, problems with cholesterol as well, and thyroid issues for women. If your thyroid is off, that can cause retention of fluid as well and lead to congestive heart failure. There are certain medications out there that are used to treat heart failure. We're not going to go into the weeds of them, but also when you go see a doctor, ask them that for whatever condition they're treating you for, you want to make sure that the medicines they're using were tested in people who look like you, one, and two, that there is something called a mortality benefit. I take this drug and have a higher chance of living longer. Not just I take this drug and it takes away my symptoms and that's it. So we call that mortality benefit. So if you have problems with that, definitely encourage everyone to seek out not only specialty care, seek out a cardiovascular specialist or heart failure clinics that can address your needs. All right, Cliff. Next question is correlation of plaque buildup and tobacco use.
Tobacco is always a very, very difficult one, and especially being in the South, you hear these stories about patients who started, dipping and chewing at the age of 8 years old, where grandparents or parents actually got them involved with it. And so there's that addiction there. And so, a lot of times people did that, as ways of just even getting their kids just to be quiet because they were up running around and they just wanted peace. But now we have an opportunity to look at that and kind of see how it has really affected things.
Mm-hmm.
And so when you think about tobacco and plaque buildup and that being one of the risk factors for peripheral arterial disease, where we develop plaque buildup in the vessels that can actually impair circulation, which has kind of led to some of our amputation pandemic here, especially in the Mississippi Delta in particular.
Right.
So that's something we definitely need to start to speak and get people to become more aware of. 21 million people affected by peripheral arterial disease, with smoking being one of those primary causes.
Right.
Um, so we have to do everything we can to educate and try to inform and transform.
Right. Well said. And people think that just, everyone smokes. It's not actually, that's not the case. Nicotine exposure is nicotine exposure. So if you dip and some people chew, some people vape. Um, Again, going back to this model, when you're born with clean pipes in your arteries, right? Everything looks clean. But as you start to smoke, or you dip, you chew, you vape, what happens is you start building these plaque buildups, and also you're disrupting the blood vessel, and it leads to clogged arteries. But for anyone who smokes, I mean, it increases your chances of having a bad outcome when you have a heart event. So your chances of having a heart event are not only higher, 3 to 5 times higher, but especially women who smoke, your chances of surviving your first heart attack is abysmal if you're a smoker. We're seeing more young female smokers in their 30s that we're sending for bypass, where they're, cracking your rib open to bypass the blockages. And as Clifton has mentioned, it increases your amputation rates by 3 to 8 fold. It was previously the number one cause of death in terms of reversible causes of death, but now it's lifestyle and dietary modification. So nicotine is bad. I'm not apologetic to that. We are very firm about the need to stop smoking or stop exposure to nicotine, because it is one way to avoid the cost. The cost of the nicotine itself is expensive, but more importantly, the adverse outcome from smoking, in terms of causing a stroke, causing a heart attack, causing you to have poor circulation, it's a cost you cannot afford, because 80% of people who lose their limbs will be dead in 5 years. So try not to become a statistic, as Clifton mentioned. And so there's a question about birth control pills and the risk for cardiovascular disease. To date, birth control pills are safe in terms of cardiovascular risks. However, if you do have high blood pressure, if you're a smoker, that can elevate your risk. And so just discuss that with a specialist if you have risk factors. And also know for people who are on birth control pills and have other forms of risk factors for diabetes or high cholesterol, just make sure that, you know, whatever you're taking, it doesn't interfere with your other medications, and it doesn't cause an exacerbation of your high blood pressure or creates a new diagnosis for you. And in that light, Clifton, what about menopause? How does menopause affect heart health?
Well, you know, as women enter menopause, they get to the point where they actually lose that estrogen protective effect. So it increases their risk for weight gain, increases risk for diabetes and elevated blood sugars. So once women actually hit that age of menopause and what we call diabetes starts to set in, it actually puts them on the same level playing field as a male in terms of their risk of cardiovascular disease. So, you know, definitely we encouraging women to become more conscientious about their heart health, doing the necessary things that they need to do, seeing cardiologists, making sure you're controlling those modifiable risk factors like diabetes, high cholesterol, making sure that you're not a smoker or having any type of nicotine exposure, just because we want to decrease that risk. I mean, when we think about women, and 1 in 3 women dying from heart disease, and it kills about 700,000 people a year. Uh,
Right.
we have to be very, very mindful of that.
Yeah, very passionate about this topic, as you can tell, Clifton is as well, because women are just simply ignored when it comes to heart health. Period. Overall, the young and the old, they're the most ignored group. For instance, they'll walk into an office and they'll say, "Well, I've been having these, you know, flutters or, you know, chest pains," and there, it's more likely to be said that, "Oh, you know what? It's probably the dog that's bothering you, or it's your kids, or it's work, or it's just in your head." But one thing that women have to note is that, you know, when you are perimenopausal or menopausal, you have to know your family history actually and know when mom went into menopause, because there is that 5 to 10 year mark where you're like, all right, listen, I might go into menopause 5 years younger than when mom went into menopause. And those symptoms are different. It's not just hot flashes. It's can be your heart racing. It can be you feeling tired. You know, you getting sweats, all signs of heart attacks, right? And so it's like, what's the chicken and what's the egg? Unless your physician is attentive and knows how to manage these patients and it can collaborate with other specialists that treat menopause, then, you know, you're just ignored. Not only that, women lose that estrogen protective effect that they get, right, when in their 20s and 30s and or in their 40s, and in their 50s it's gone. That's why the heart attack rates are actually more elevated during that time period. That's why some of them start having all these problems, blood pressure problems, and they start having heart events and vascular events. So make sure you just go and see someone who knows what they're talking about, or seek a second opinion when you don't trust what you've been told in the first place. We can spend a whole day on that topic, but we have to move on. um, what are warning signs of heart disease? I guess nausea, vomiting, chest pain, jaw pain, arm pain, more left than right side, but don't ignore it if it goes to your right. Pressure down your heart. If you feel that you get tired, fatigue is a big one. For anyone who's watched the show The View, most of those women who started The View, if you look at the history, majority of them have some form of heart disease, and some of their symptoms were just vague. It was, you know, I felt tired, or, you know, I couldn't get a woman who was falling in the parking lot of the grocery store into her car because, you know, I was out of energy. You might want to assess, you know, what's going on with your heart in form of a ultrasound of your heart or stress test. That is to see if you're getting good, adequate oxygen-rich blood flow to your heart. And then, you know, if you're having other symptoms, people who have incessant hiccups, I've had 2 women who present with heart attacks with just incessant hiccups. And then if you feel that you know, you've passed out for unknown reasons, you want to make sure your heart too is checked. Anything else, Cliff, you want to add to that?
Just, so many people now get caught up on the symptoms of like heartburn, and they think, well, it's just acid reflux or something that I ate. And that too can also be another one that they need to be aware of in terms of warning signs.
Right,
And then, patients that have uncontrolled hypertension is also another one, that can be an early sign of ischemia with the heart as well. So, people just definitely need to be more conscientious about these things and never just downplay it and just think, well, maybe it was something I ate or maybe I moved wrong.
right,
Uh, just need to get checked out.
right. And then how you lower your risk for heart disease. Well, that's it's one thing. It's you are what you do in terms of your lifestyle and dietary habits. That's the first thing you have to address. We mentioned earlier, sugar is the new tobacco. You got to cut out that as much sugar as you can, and but also exercise. But you have to know your family history and know your numbers. So if you're a diabetic, you have to know your hemoglobin A1C. So what's a hemoglobin A1C? It's basically, your blood vessels carry protein, and on this protein there are uh, sugar, carbohydrates that are on that protein, right, in your red blood cells, and they can tell you what an average sugar level in your bloodstream has been for the last 3 months. And that hemoglobin A1C should serve as a passport for every diabetic, because it tells me if you are at increased risk of having an adverse outcome or presenting with worse disease than someone who has either a low or is not a pre-diabetic or is not a diabetic. So you want to make sure that, one, your hemoglobin A1C, that number should be less than 7. You want to make sure that if it's above 7, that you are seeing a specialist, endocrinologist, or the name of the specialist, and in conjunction with your primary care docs. Your hemoglobin A1C, if for every 1% increase, can increase your plaque buildup percentage by 28%, especially in your lower extremities. And that is one of the reasons why we see a lot of diabetics present with late stage peripheral arterial disease and ultimately have 130,000 amputations a year. So it's definitely important to avoid that stage. Two, when you have poor sugars, your wounds don't heal, right? So if your sugars are high, you're not going to get good wound care. If you've had high sugars, they can cause chest pains. They present with chest pains. A lot of patients come in to see us, and they think they're having a heart event. The stress test is normal, and then we say, "What's your sugar?" Well, my A1C is 13. Well, that's why you're getting chest pains. And also you want to make sure that your blood pressure is controlled. Less than 130/80 is the number. And you want to make sure you're on good medicines. You want to make sure you have good habits. If your sleeping is an issue, make sure you rule out sleep apnea. Make sure you've had, you avoid those caffeinated drinks, as Clifton mentioned. And you want to make sure that your cholesterol numbers are checked. Make sure your cholesterols are aggressively checked. Your low LDL, your LDL level should be less than 100 or less than 70 if you've had plaque buildup before. And your HDL, your good cholesterol should be on the high level, right? Like the higher, the better. And lastly, you want to make sure that you avoid smoking. You want to avoid drinking. Drinking a glass of wine, 1 to 2 glasses, is good. Anything other than that, I do not endorse. So I know a lot of women are probably watching and saying they're going to go drink a whole bottle of wine today. I did not endorse that. All right. 1 to 2 glasses. That's it. And then, again, your family history. Make sure you get screened, because that's how you stop that generational scar. Make sure that your kids know their history and what have you too. Anything else you want to add, Clifton?
Yeah, the only thing I would add is that, if you are one of those patients that have unfortunately been diagnosed with diabetes, and you've been placed on metformin and your blood sugars are still not under control, go back and have that talk with your primary care provider about putting you on medications that actually have that mortality benefit, and don't just be stuck with metformin. Metformin has a lot of horrible GI side effects, and it causes patients to stop taking them because of the nausea, the vomiting, the diarrhea. But there are other options out there. And so if we have any intentions of being able to help decrease that risk of cardiovascular disease, be it heart attack, stroke, or peripheral arterial disease, managing those blood sugars are very, very important.
Right.
There are medications out there now that actually have a benefit for the heart, such as Jardiance and Farxiga. So I would definitely encourage patients to talk with their providers to see if those medications are right for them.
Right. And in terms of diets, we're asked what diets do we endorse or can we endorse? As a member of, a couple of councils and as a member of, the Association of Cardiovascular Coalition and Association of Black Cardiology as well. There's certain things that I cannot endorse in terms of diets. We go by the studies and the guidelines, and so far, for patients who have high blood pressure, a DASH diet, DASH diet is what's endorsed for them. Other than that, a Mediterranean diet is the diet of choice in all other patients, irrespective of your risk. And so that incorporates plant-based, diets to it. I cannot talk about keto or anything else because I can only speak to what we can endorse as a society for the purposes of this Instagram event. It's not going to do any justice for us to delve into other diets. With that said, let's go into what are some common irregular heart rhythms. People who are young can have what we call premature ventricular contraction, PVCs. That's normal. Your heartbeat skips. Everyone has felt that at some point. Stress can do that. The way you breathe, you take a deep breath in and out, can alter actually your breathing cycle. So if you're anxious, your anxiety, or you're running and what have you, if your electrolytes are off, right? If your electrolytes are off, you can have irregular heart rhythms. And if you, as we get older, so in our young 20s and 30s, we see this in more women who have super SVT, which is a supraventricular tachycardia, where they'll have to see an electrical cardiologist, or also known as an electrophysiologist. And there are certain medications and procedures that can 99% of the time eliminate those. And then in more so patients who are either older, over 60, patients who've had heart disease, patients who've had high blood pressure, who have sleep apnea, who are obese, you see atrial fibrillation or atrial flutter. And that's where the top chamber basically has its kind of electrical seizure activity, and it's chaotic, and you have to get it back into an organized state. The problem with that is that you have to make sure that these patients are risk stratified. So what are the chances of you having a stroke if you have an irregular heart rhythm? It all depends on what we call a CHA2DS2-VASc score. So your score is calculated, and then we determine if you need to be on blood thinners. And those blood thinners prevent you from getting a stroke, irrespective of if you're in a regular rhythm or irregular rhythm. So definitely, know your numbers, but also know your rhythm. I know everyone has an iWatch now, right? They can check their heart rhythm on there. But if you suspect you're having an irregular rhythm, you need an EKG. A 12-lead EKG is the best way to get that in a doctor's office, where they can take a look at it and determine if you need any further studies. They can look at the structure of your heart. They can look at your labs. They can look at, any further testing that's needed in terms of circulatory, and then they can determine if you need any other invasive or non-invasive procedures. Anything else, Clifton, to add to that?
I guess, the fact that you brought up about atrial fibrillation, that does increase patients' risk for actually developing blood clots as well as stroke. So, if they are one of those patients that have been started on anticoagulant therapy to actually help reduce that risk, it's very important that you actually adhere to that medication regimen and stay on it. Irregardless of when you were first diagnosed, patients have what we call paroxysmal AFib, where they go in and out of it. So even if it's been several years since you've had your last event,
Right.
you still need to be on that medication to help decrease that risk. Because I'm sure, as you're aware of as a cardiologist, You know, there are a lot of things that you can reverse, but you definitely cannot reverse the effects of a stroke. So,
No, 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 we can't. And speaking of irregular heart rhythms, your thyroid. So any young lady or any lady period who's watching, you should know your thyroid numbers, right? Because the thyroid can either slow your heart rate or accelerate your heart rate, and that can cause problems. Also, thyroid levels can also constrict your blood vessels if they're abnormal, and therefore cause retention of fluid, as I mentioned earlier, and increase your cholesterol levels. So know your thyroid levels early on, because that's something that some docs skip over. You know, they'll do the whole routine workup and then forget to check your thyroid levels. So that's an easy check and easy fix if you need. Um, and then let's see. We have one about sleep apnea. I think we touched about it, on it. Clifton, anything else to add about sleep apnea before we go into PAD?
just the fact that, you know, patients that have sleep apnea is very, very important that it's treated and it's managed. You know, and it can be really, really subtle. So, you know, I hear patients all the time say, well, you know, I don't have sleep apnea. I sleep well at night. And that may be true. But, you know, if you're one of those that go to bed and you sleep for 6 hours and you wake up and you're fatigued and feel like maybe you've only slept two, or if you find yourself waking up in the middle of the night and you're, you know, choking or gasping for air. Also, symptoms like acid reflux and heartburn in the middle of the night. All of those are things that could actually be indicative of sleep apnea. So, you know, I tell patients all the time that, you know, whether it's you or a family member, you know, people always make fun and be like, man, you were calling the hogs, as you said earlier. Yeah, that's something that needs to be checked out. That's not
Yeah,
you can just write off because of the long-term implications of that with elevated blood pressures. They can cause electrical arrhythmias with the heart. Eventually, that heart pump function decreases, and then patients develop what we call cardiomyopathy and develop irregular heart rhythms that can actually lead to death. So, you know,
correct.
it's real.
Yeah, it is. And we have an obesity problem. We have an overweight problem. It's not just one household, it's an American problem, whereby, you know, over 50% of the population is either overweight or obese. And what happens is that people need to realize your neck size actually has a lot to do with it. And what happens is that, you know, if you have sleep apnea that doesn't go diagnosed, and you run into all these problems, if, you know, doctors will say, well, listen, go lose weight. One of the biggest pet peeves I have, right? I go lose weight. Well, guess what, smart pants? I cannot lose weight if I don't have enough oxygen going to my heart and my lungs for me to be able to walk or to exercise, right? So
Right.
all these doctors walk in with their white coats and like, yeah, you know what, Mr. Smith, go lose weight. Like, no, that's not the answer. The answer is like, let me help you lose weight. So let's guide you through it. Let's rule out things that are pathological, things that are reversible. If you need a sleep study test so you can be on the CPAP machine, so you can get good oxygen, so you can be able to walk the 150 minutes that I'm recommending, then that's how we start. And then we set goals. Okay, do I need to lose 3 pounds a month, 5 pounds a month? You know, realistic goals. But it's not just about, you know, telling and how we communicate with patients. You have to tell them, you know, these are potential reasons. It's not in your head, it's real. And let's guide you there. And so just, you know, just be mindful of that when speaking with patients, whoever is in the medical field or profession. These patients don't know what they don't know. And then two, it's coffee, you know, caffeine intake. I forgot to mention this, very big a question. You know, what's good for the heart or not? You know, caffeine intake in terms of coffee, 1 cup of coffee has been shown to be good. I'm not personally a coffee um, drinker. Um, all the rest of my staff members are. So it's safe to drink a cup of coffee, but if you drink excessively, you can have palpitations, and you could present to my office complaining of irregular heart rhythm, and you'll be told to kind of decommit to your 3 cups or 4 cups that you drink every day. So just take note of that in terms of irregular heart rhythms as well. I forgot to mention that earlier. All right. How can I reduce or reverse heart disease. Well, heart disease itself, this process that we talk about in terms of atherosclerosis, which is the buildup of plaque and cholesterol that leads to this, right? It starts out that when we're born with clean arteries, right? And it progressively develops plaque if you have either poor habits or you develop conditions like risk factors for heart disease, high blood pressure, high cholesterol, diabetes, you're obese, you have a family history. So you can't necessarily reverse that process. You can control it. You can, decrease the acceleration and mitigate and stop the accelerated pathway. And that accelerated pathway is only exacerbated by nicotine use or having your sugars uncontrolled or your blood pressure uncontrolled. So Father Time is undefeated. We need to make sure that we're aggressive with lowering our cholesterol, and that's why our diet and exercise are very important components to that. And to the question about peripheral arterial disease, Clifton, do you want to tell them about PAD and risk factors for PAD? They hear about it from me a lot, but they need to hear about it from you as well.
Yeah, absolutely. So, if you're 45, 50 years old with a history of high blood pressure, diabetes, high cholesterol, if you have a family history of excessive plaque buildup, anybody with a history of coronary artery disease or have had a heart attack before, anybody with a history of stroke before, diabetes, kidney disease, and then of course the nicotine exposure. So whether you smoke, dip, chew, vape, all of those are things that actually play a part in this. But we also have to think about those things that we cannot change. So if you're African American, if you're Hispanic, or you're a Native American, you're 1.5 to 3 times more likely to actually develop plaque buildup as your white counterparts. And so we have to be mindful of those things. So reducing that sugar intake, limiting our intake of salt, so that we can modify those risks for diabetes and high blood pressure. Those are very, very big things, so that we don't continue to add to that number. So when we hear about PAD and 21 million people being affected, but not a whole lot of talk is actually placed on this. So you mentioned earlier about women and their heart health and all of that, and people will go to their OBGYNs and they'll have pelvic exams and their annual wellness visits every 1 to 3 years, but yet and still a lot of people have never been screened for PAD.
Correct.
Some of that is on the patient, but also as providers as well have to do a better job of actually recognizing those risk factors and actually screening early on.
Yes, you preach. We have an awareness problem. We have a compassion problem. We have a greed problem when it comes to our healthcare. We have a problem of not addressing social determinants of health. We have a problem of not having policies in place to protect those who are marginalized and who have suffered intergenerational scars, particularly people of color. We have a problem with people who have not really done their part to see it through, that equity is achieved. There's a difference between equality and equity. So everyone needs to be given a fighter's chance. And that chance is one, if we know we have risk factors for heart disease and cardiovascular disease. And I'm going to define cardiovascular disease for those who join late. Cardiovascular disease is a combination of disease states that comprise of the following diseases. 1, coronary artery disease, your heart. 2, cerebral vascular disease, so if you've had a stroke or a transient ischemic attack. 3, if you've had arrhythmia, irregular heart rhythm. 4, congestive heart failure. 5, peripheral arterial disease, poor circulation to your legs and your feet or your arms. 6, if you've had congenital heart disease, where you're born with a hole in your heart, or any other issues that were diagnosed when you were an infant. And then 7, if you've had some form of valvular heart disease, your valves. But there's one more that everyone forgets. If you've ever been diagnosed with clots in your lungs, pulmonary embolism, or for those of you who have swelling in your legs and your feet at the end of the day due to venous insufficiency, one of the most chronic and prevalent syndromes that most people have never heard of too, you have cardiovascular disease. So that constellation is what you need to know. And once you know all these things, then you can say, okay, when shall I see a doctor or a specialist? Well, you see a doctor or specialist if you go to your primary care doc, or you're having symptoms and you feel they're not getting addressed, then you seek out a cardiovascular specialist. It's that simple. Um, it's no offense to the primary care providers, just that they're people who are specialists for a reason. They're people who are having that advanced training, and they're people who have a better sense as to how to treat like venous insufficiency or PAD better than people who are not trained in that field. It's just what it is. So it behooves everyone to be informed, to know your risks, know your numbers, know when to seek specialty care, and if not, seek a second opinion. I mean, we need to start incorporating that into our vocabulary. Don't just see someone who's a physician or doctor, and I'm talking to people who come see me as well. I would tell my patients this: if you do not believe anything I tell you, seek a second opinion. You have that right, because what I cannot guarantee you is that the day someone takes away your limbs or takes off your limbs, I cannot replace that. The day you lose your heart, you die. The day you get a stroke, I can't reverse that. The day you end up on dialysis, the chances of you getting off of that dialysis machine is slim. So, be informed to be transformed, but be more of a preventative mindset is the key. And that's why we wanted to host this event today. We're thankful for everyone who's joined. If there are any more questions or any thoughts, Clifton, before we either take more or we end it, let it be known, brother. Tell the folks some more, spit some more knowledge, spit some game.
Yeah, and so one of the things that we kind of touched on a little bit is we talked about hypertension, but I want to definitely encourage people to know your numbers. There's this thing that's called ambulatory blood pressures, where we actually are encouraging patients to check your blood pressures at home, because the worst place in the world to check your blood pressure is in a doctor's office.
Yeah.
You're rushing to get to your appointment. You come in to ask you about a copay. You had to have a seat in the lobby and wait, and
You're trying to figure out the name of
wait.
the doctor. How do you pronounce his name? Factorate what?
I know, right? Yeah. So definitely know your numbers. Get those ambulatory blood pressures at home. If you go into your doctor's office and they tell you that your blood pressure is elevated and that they want to start you on the medication, ask them to allow you to go home and do ambulatory blood pressures and get an average of your blood pressures for about 5 days, because your ambulatory blood pressures at home when you're in your element and relaxed. That's
Yeah.
the most predictable indicator of whether or not you have high blood pressure and how well it's controlled.
Good. Mom Teasy, that's a good one. See, Dr. Montezi. Dr. Montezi, I like that one too. Shout out to Dr. Montezi, great guy.
Yeah.
Welcome
Hey,
back.
Dr.
Welcome back, Doc.
Montezi.
All right. So, any other questions? I think we've addressed most of the questions that were listed. It's been fun. This has been great. We thank everyone for joining us today. Unfortunately, we have to go back to work. I need to get Clifton paid, so gotta go. We'll do this again. We'll do this sometime soon. Clifton, you're awesome. Thank you very much. I'm truly honored and privileged to call you my nurse practitioner, but more importantly, we'll call your brother in arms. And thank you for taking care of not only the community that we serve here, but taking care of your teammates here in the practice as well as a servant leader. So appreciate that.
Absolutely.
All right.
It's a joy to work with you and be a part of your team. Thank you for your vision and your desire for what you want quality healthcare to look like in the Delta. You make it easy to work side by side with you, brother.
All right, man. All right. Be blessed, everyone. We'll see you next time. Take care.